Hey there, Dr. Ryan Hetland here, RH Health and Injury Specialist. Wanted to give you a second video here in the series about sciatica on the most common cause of sciatica, which is a disc herniation. So the discs are the pads between the vertebra, the two bones, and the pad that sits between the vertebra that are like cushions, and they also are meant to give the space where the nerve hole is, where the nerve comes out. So the disc commonly, as you have a vertebra that is misaligned, out of alignment, will start to degenerate, and that just simply means it's wearing out. Kind of like an unaligned tire would just simply wear out the tire. The same thing happens to the disc, which has these fibers here that can wear out, and this nucleus that sits in the middle will start to herniate out, and I have a visual here I can show you in a minute. But basically what happens is the nucleus in the middle starts to tear through the fibers there. That's called a herniation. And when that disc gets thinner and thinner and wears out, degenerates, that nerve hole gets smaller, or the disc itself that herniates can bulge into the nerve hole. And there's a video here kind of showing you here about disc herniations. And just one little thing, about 1 in 50 people will get a disc herniation in their lifetime. And most of them will have symptoms that last 6 weeks or more. And a lot of these things can be treated. A lot of them can be prevented, but oftentimes we're catching this after the fact. Here is a picture of a disc herniation on an MRI. The red just kind of points out how that disc is bulging, and the white here is the spinal cord on the MRI, and the black here and this bulging balloon-like thing is an extruded herniated disc, and this is what it looks like from the side. So here's normal disc, and you can see this one black and herniating out like that. So I'll pull up another thing here that can really demonstrate how a disc herniates. Forgive the shakiness here of the screen, but this here is a normal healthy disc where it's nice and thick. Hopefully you can see that between the there you go, a little better, between the bones here. Here's the disc, nice and thick, normal, big nerve hole here, and how you're looking at that is the vertebra from the side, and when you flip it and look at it from the top angle, that's what you're seeing here, where you see the spinal cord, the disc, the nucleus, and then here's the nerves that come out. And as that herniates, it'll start to bulge like this. The disc will start to get weak and bulge. And a couple things that happen here to point out is you've got the disc itself compressing down. So the disc is compressing, and the disc itself starts to bulge out, and if these fibers start to tear, you get a disc herniation. This is by far the most common reason for sciatica. We'll get into on a future video how to treat this, but just to plant seeds of the problem here is the disc pump mechanism starts to get lost, and it degenerates and it dehydrates. So trying to unlock the vertebra and repump the disc through something called spinal decompression, using things like cold laser to help a disc to heal, helps tremendously. My office is one of the few that can do laser guided decompression, and for the low back. So decompression, chiropractic, laser, all conservative things we use here in the office, but I'll go into on a future visit how that works and describe that more. I hope this helps you understand sciatica and the most common cause as a disc herniation. Thanks for watching.